Former President Bill Clinton is in the hospital being treated for a blood infection. Doctors say Clinton first reported feeling sick Tuesday during a private event for his foundation. They believe it may have started as a urinary infection that spread to his bloodstream. And that's a common occurrence in older people. Hospital officials say the 75-year-old is responding well to treatment and could be discharged as soon as tomorrow. Joining us now to break down the diagnosis and what it could mean is Dr. Sophia Ford, a urologist at Madison Medical Center. Welcome back to BNC.
Thank you for having me.
So we just mentioned that this is a common occurrence in older adults. Break down, what is this diagnosis? What does it mean? What do people need to know?
So typically, one can develop a urinary tract infection that can present with flank pain, burning with urination, urinary frequency, and it's typically treated with antibiotics on an outpatient basis. Sometimes, however, patients don't necessarily realize they do have a urinary tract infection or how severe their urinary tract infection is. And the infection can spread to your kidneys, causing what we call an upper urinary tract infection or pyelonephritis. Now, about 25% of your blood volume filters through your kidneys. So if there's an infection there, it would be relatively easy for that infection that was in your urine originally to spread to the blood.
Wow, and how dangerous is this?
So unfortunately, these infections can be deadly, but typically when they are caught, most people are symptomatic. You feel fatigue, you feel run down, you can have fevers, you can have back pain. And so most people usually present to the hospital or their physicians and are treated with antibiotics. So with proper treatment, they're usually not fatal.
And in terms of severity, does age factor into that?
Well, the older you are, the less reserve capacity you have, the less ability you have to kind of bounce back. So it can be a more severe infection, something that in a typical 30-year-old, they may not require hospitalization for this. A 75-year-old most likely would.
And talk to us a little bit about treatment. We said that Clinton's going to be treated with some antibiotics. What do people need to know on that front?
So typically, the antibiotics that we would use would be from the fluoroquinolone family, the cephalosporin family. IV antibiotics are the mainstay of treatment when you're in the hospital. Once we've completed an intravenous course, we typically send you home with oral antibiotics to make sure that the infection is completely eradicated.
And we mentioned that the infection started as a UTI. We often think of UTIs as something that impacts women, but how rare or common are urinary tract infections in men?
So they are not that common in men who have not previously had any urologic history or trauma or instrumentation. So when we find urinary tract infections in men, we take it very seriously and we look for an inciting cause and a way to prevent them in the future.
And Clinton, we know, has had some issues with his health in the past. He had a quadruple bypass surgery in 2004 and some other issues with his heart. Do these past health issues have any impact or bearing on what he's going through now?
So with what happened in 2004, that should not have bearing on what's going on right now. Typically, though, patients who've had a triple bypass or any type of bypass may have a slightly weakened, they may be slightly deconditioned. I don't believe that that's President Clinton, former President Clinton's case here, though, but sometimes those patients are deconditioned and maybe not in the best of health and would be in an immunocompromised state, which means that the infection could potentially be more serious in them.
So just break down for us, what are the symptoms that people should look out for?
So for a typical urinary tract infection, it would be burning with urination, increased frequency, meaning you need to go to the bathroom more frequently, but you're not urinating a large amount, maybe just small amounts are coming out. Maybe some suprapubic pressure or lower back pain, what we call flank pain. Signs of sepsis are typically going to be a little bit more severe, like a elevated fever, sometimes shaking, uncontrollable chills, nausea, severe fatigue, really needing to sleep a lot, and overall just not feeling well.
Well, thank you so much for being with us this afternoon. Howard University students fed up and frustrated. They're protesting living conditions on campus and calling for change. We're breaking down their message after the break.